Hello, I'm Dr. Bolanle, your host on the Bright Minds MD and your mental health podcast. Here, we discuss topics designed to explore the full spectrum of mental well-being. You'll hear from experts and listen to personal experiences that inspire and inform. So, whether you're seeking insights, solutions, or just a dose of motivation, this podcast is your perfect companion. Hit that subscribe button and join us on this incredible journey to mental well-being. Your whole health starts with your whole mind. Let's get started. All right, we are live. Good afternoon, everyone who's watching, and thank you for joining us. I am Dr. Bolanle Akinronbi, psychiatrist and founder at Bright Minds MD, where we help people with anxiety and depressive disorders live well and feel well using fewer medications and wellness practices. I'm very excited today with my guest who's joining me. She is Dr. Sadaf Lodhi. She is an OBGYN by training and also a sexual health coach and educator, as well as a sexual health counselor. She is fully certified, and I'll let her tell us about herself in a little bit. We will be talking today about sexual health as part of mental health, but also specifically focusing on hypoactive sexual desire disorder. Welcome, Dr. Sadaf.
Thank you so much for having me on. I really appreciate it. Thank you.
Sorry, I'm still not sure about
That's Siri interrupting us. So how did you get interested? So you're an OBGYN, so I'm sure sexual health is a big part of what you do, but how did you get interested or zoning into sexual health as a subdivision of what you do?
Yeah. So, basically it started out as patients asking questions and me not really feeling equipped to answer those questions. And so, as you probably know, and I don't know what it was like in your medical school, but at least in my medical school, we barely got any education on sex. And what we learned was the Masters and Johnson theory, right? From 1966. And that was done on old white men, and as we know, women are not men and don't necessarily respond like men do and have a different sexual response cycle. And so flash forward to residency, and we didn't get much training there either. In fact, recently I was on faculty at academic institution, and there as well they did not focus on sexual education, and their residents did not get any training on that either. So really, what happens when you're a gynecologist and you start seeing patients and they start asking you questions and you don't know the answers to them? You have to kind of figure it out yourself. And so what I did is I decided that was something that I wanted to take on. And I felt that I didn't have the knowledge for it. And so then I signed up for a course through the University of Michigan, and it's a sexual counseling and education course. It's a year-long program. And I just got certified yesterday, which was very exciting for me. And yay, thanks. And so, I think that was something for me that was really important. It was something that patients desired and wanted. And I wanted to have the proper information to give to them when they sought help.
Absolutely. And how fantastic when, we see a recurring problem in the practice and we do something to address it and to fix it so that we can better service the people who come to us. Yeah. And so to get right into it, sexual health is so important for overall mental health. And oftentimes people are shy to talk about it.
Yeah.
Or shy to bring it up, but I can imagine that if somebody wants to have sex and don't feel like they're able to, would like to have desire but don't have it, or are not able to perform in the way that they would like to perform, these would eventually manifest in many ways in relationships and in engagements with others. But it's a major cause of dissatisfaction in life, which is why I think it's important to bring it up. So what are, if there are any causes, what are the, common causes of this hypoactive sexual desire disorder, if there are any?
Yeah, absolutely. So, just really quick before we get into that, I think what you mentioned is very important, about how sexual health is important for your mental well-being. And I think what happens sometimes also is that we get into this cycle of sex negativity. And so when, if we are experiencing something such as low desire or body image issues, or say that, if you grew up in a culture that was very sex negative, or you were traumatized, or you had some type of abuse, whatever, all of those things start to compound and stay in your head, right? So then when you go on and try to have a relationship or start to engage in some type of physical intimacy, all of those thoughts come into your head. And that's actually where, just to kind of sidetrack a little bit, but that's where a coach comes in, right? So for sexual coaching, intimacy coaching is, you see where the person is right now and whether or not the thoughts that they have are serving you. And then how can you go about changing those thoughts to something that actually does help them in the future, right? And that's a little bit what we talked about is cognitive behavioral therapy. And we use that a lot. Yeah.
It sounds like CBT.
We use that a lot actually in coaching. And I love to use it with intimacy coaching for my patients, because a lot of times we start with, and all about this, is that we know that our thoughts are something that we get to choose, right? We get to decide whether or not these thoughts are serving us. I mean, we have so many thoughts that go through our mind throughout the day. And then we know that those thoughts then lead to certain type of feelings, which then will lead to certain type of actions. Absolutely. And so if we go to the root cause of the problem, and if we start with sex negativity, and if we can change that to one of a more positive thought, right, then we can lead to a more positive feeling, which then will lead to a more positive action. And that is kind of how the coaching part of it works. But you talked a little bit about decreased desire, so the hypoactive sexual desire disorder, which is actually a DSM category and actually a diagnosis that people can use in practice for women that come in with decreased libido. And a lot of times the way that we approach that is by looking at the biopsychosocial model. Okay. And what that is that we will first go ahead and assess the anatomy and make sure there's nothing anatomical going on for which, a person may be experiencing decreased libido. Mm-hmm. One of the causes of that may be, for example, say if the woman is perimenopausal or menopausal and she's having what we call the genitourinary syndrome of menopause, which is where you have like painful intercourse due to vaginal dryness, and or if you have recurrent UTIs or if you have recurrent infections, any of those things can cause for painful intercourse. So the bio part of it is looking at anything anatomical or even medical. Say that somebody has, diabetes for which they're taking medications, or high blood pressure for which they're taking medications. Sometimes those medications can affect desire and cause decreased desire. So that's where we start out with, typically, is the bio part of it. The psycho part of it is the psychological aspect of it. And that's, of course, where you come in. And, is the person suffering from anxiety? Are they suffering from depression? As you know better than anyone, is that can significantly impact relationships. And oftentimes when patients are taking medications, for example, antidepressants, such as SSRIs, yes, we know that a common side effect of that is decreased libido. And for people that may not know what an SSRI is, that's, those antidepressants like Zoloft and Paxil and all of the, right, Prozac, right? Those are the most common ones that oftentimes patients will use, and that can affect how a patient feels and a decreased libido. We also know that sometimes birth control pills can affect libido as well, right? Yes. Sometimes calcium channel blockers, that can affect libido. And we know that Wellbutrin actually helps. Yes. And for patients that are maybe depressed, and if they're able to switch medications, we know that Wellbutrin, it does not affect libido as much as something like an antidepressant like Zoloft and Paxil. And then the social model of it is where, what is going on in that person's life, right? Are they a single mom that's trying to raise like kids on her own, like 3 jobs? Does she have so much stuff going on in her life that the last thing she's worried about is, physical intimacy with her partner, right? They also say that uneven distribution of household chores, for example, if somebody is, right? So a lot of times working moms have this where they're working outside of the home, and as soon as they come home, they start their second job, right? Where they're taking care of the kids, they're taking care of the house, they're making dinner, all of those things. So that can definitely affect libido, because if you're constantly exhausted from doing everything else, you're not going to have enough reserve to interact with your partner in a meaningful way. right?
Absolutely.
And also the social aspect of it comes in when you have some type of cultural negativity, and like we talked about before, some type of abuse, some type of trauma. Any of those things can also affect libido. So when we look at a patient, when someone comes in with decreased libido and this hypoactive sexual desire disorder is only diagnosed when it is distressing to the patient. So if she is experiencing decreased desire, but it's not distressing to her, then it's really not a problem.
Right.
It's only a problem if it's, impacting her life in a negative way and she wants to change it, then that's when we start to go ahead and assess it.
Interesting. Thank you very much. Let me just, for the people who are listening, I want to recap real quick. And I'm also learning. So thank you so much for sharing your expertise with me today. What I'm learning so far is that I really enjoy that biopsychosocial model that you use in the approach, because it really breaks down the different things that could be contributing to the loss of desire that's causing problems. So as an OBGYN, if there are anatomical issues, these are things possibly I imagine you would be able to offer an intervention for. If it's menopause, there are treatments for that are separate. If it's medications, then it's about reevaluating what those meds are and making necessary changes or substitutions that work. You also talked about, our common ones. The common one for me would be the antidepressants. This comes up a lot. As you must know, I prescribe a lot of antidepressants, and then we're saying, what do we do? How do we reassess this and make changes? And then social events, very important for a lot of moms who are just worn out because they are taking on the burden at home, doing all the chores and not having as much assistance as they would need. You mentioned something earlier that it's only a disorder if it's causing distress to the person. In some cases, though, some women are bringing it up because it doesn't distress them, but it distresses their partner.
Yes.
Would you treat in this situation as well?
Yes, absolutely. I mean, so, we have to look at the patient as a couple, right? So definitely you want to work with the patient and you want to address her issues and what's most distressing to her. But if it's impacting her life and it's bothering her and also her spouse, then I would definitely address it. And even if it's not bothering her as much, but the reason why she has come and she's approached you is that it is impacting her life and it's impacting her relationship. So then in essence, it is, affecting her as well. So definitely I would go ahead and help her out as much as I could. And oftentimes when it's something like that, where it's more the partner than it is the patient, then I feel like that's where really, barring anything anatomical and meds, that's really where the coaching comes in. And then I would go ahead and assess what her thoughts were around, developing that physical intimacy with her partner and see what's really going on with the relationship and, what's holding her back and what is it that she really wants to achieve in that relationship.
Thank you very much. That's very, very comprehensive. I was going to ask you this question, but I feel like I can answer it already. I think what you bring to the table is that in addition to being an OBGYN and being able to do the meds and the anatomical stuff, your coaching and education training allows you to also do the cognitive work that's required, especially if there are attitudes and beliefs that are involved in that process. I think that that's really special. But in your own words, if I've missed anything on that, you can certainly tell us also anything else that's additional in terms of your approach or the treatment that you offer.
Yeah, absolutely. So that's exactly what I would say is that, what sets me apart from other people is that I do understand the anatomy. And, you would be surprised, and perhaps maybe you wouldn't, knowing that a lot of women are really actually not even sure what their anatomy is, right? And they don't realize that there are, 3 different holes and what each of those holes represent and things like that. A lot of women are just not familiar because they haven't been either, they never learned it or were ashamed and told that, those are things that you don't learn about, or perhaps they weren't able, never even took a mirror and took a look at their own anatomy to see what's going on. So I think that, really going over the anatomy with a patient also is really important. I know that, I'm not sure if you know, but there was a New York Times article that came out about the clitoris, and the physician that was quoted in that article, she basically gives her patients a mirror at their visit so that she can explain to them the anatomy and show them, and so that they can become familiar with what their anatomy is. And that way, if they ever have any problems, they can use the proper vocabulary and seek guidance and seek help for that. Also, I think that, just exactly what you said, right, is coaching the patients, because oftentimes we come with a lot of limiting beliefs. We also come with thoughts that don't give us permission to learn. And so I think one of the most important things for women seeking to learn more about their sexuality and more about what may be holding them back is giving themselves permission, allowing themselves to feel and learn about their own sexuality, which then gives them agency over their reproduction. And I think that that is super important.
Very, very, very important for women, absolutely, as individuals, and also for relationships.
Yeah.
I can imagine that improves relationships. So thinking about an example, I don't know, do you have a case, like when people have worked with you, what are, maybe if you can think of one or two patients, what are the outcomes that they've had from working with you to improve the decreased libido or hyperactive sexual desire?
Yeah. Well, so one patient that I had that comes to mind is that she was noticing that she and her husband had mismatched libidos. She felt like her libido was much higher than his. And what she realized is that something very basic that we take for granted was communication. They weren't really communicating about their desires and wants and what they liked and what they didn't like. What she also realized is that for her, the best time to be intimate with her partner was at night. And for him, it was in the morning. Oh, wow. So what then they did, and they hadn't even realized that until they actually started setting aside time every single night to talk. And,
communication.
Yes, absolutely. Communication. And and it sounds so basic, but that is really the fundamental essence of increasing intimacy in a relationship, right? Is that communication. And sometimes we get so busy with our jobs and our responsibilities and children and everything like that, that really we have no time for our spouses or our partners. And by the time the end of the night comes about, we're completely depleted and we just want to go to bed. And so what she realized is for her, she started to schedule in that time. So in her calendar, she would put in, every night, 15 minutes, and it started with 15 minutes, right? Because you don't want to overwhelm the patient or the client. And so she started with something small, something that she felt was doable.
Okay.
And so she would start with 15 minutes every single night, and they would communicate about what they wanted, what worked for them, what worked for her, what worked for him. And then they came to a common medium. So they would, sometimes they would be more intimate in the evenings, other times in the mornings, whatever. And so that they were able to meet at a common ground. And she found that to be much more fulfilling. And she realized that it wasn't that, and he realized that it wasn't so much that they had a mismatched libido, it's just that they weren't communicating what their desires were. And so they were able to find a common ground. And now when I talk to her and, circle back, she's much more happy, and they find that their relationship is much more fulfilling now because they're able to communicate about their desires.
How wonderful, wonderful, wonderful for them, for the two of them to be able to come together like that. So two things that jumped out at me there was communication, setting aside time to prioritize that, and also compromise, because they both preferred it at different ends of the day. So they rotated around to pick times that both of them can have their priority times met. Apart from these two other things, what are some other tips you may have for people listening to us who might have this problem or thinking they might have it, tips that they can use to maintain their sexual health or improve their desire if they're having trouble with that?
Yeah. So one of the most important things that we can practice in our relationship and really in our lives is to practice mindfulness. And I know that that's a real buzzword, and people use that as like a hashtag and things like that, but it's really important. There's been lots of studies that have been done that have shown, clinical studies that have been done that have shown that for women that have decreased desire and decreased libido, practicing mindfulness really helps to increase both desire and arousal in women. And we know that Being mindful is just being present in the current situation that you're in without judgment and being compassionate to yourself. So, that really improves the arousal and libido. And if we think about it, when we're mindful, we are just really focused on whatever it is that we're doing or where we are at that time, right? So imagine if you brought that mindfulness to when you were starting to become intimate with your partner, right? That physical intimacy, so that you block out everything else, all the other distractions, the laundry that's sitting there, the dishes in the sink, all that stuff, right? You block all that out. And so all you're doing is focusing on your partner and what's going on at that moment. And that in itself will increase arousal and will increase desire. Also accepting and loving yourself as you are right now. I think a lot of times, we will notice so many things wrong with ourselves, right? Like, oh, I'm not, smart enough. I'm not attractive enough, whatever, I need to still.
Body flaws.
Exactly. Body image, right? I still need to lose like 10 pounds, whatever it is. Just accepting and loving yourself, because when you're able to accept and love yourself, then you're able to then show that love and give that love to somebody else, right? But it all starts with ourselves and loving ourselves. Realizing also that love and intimacy will look different as we age. And I think that is super important. And realizing that, when we were perhaps younger, we thought that everything was spontaneous, right? That, and now it's almost like, oh gosh, now we have to actually schedule it in.
Scheduling.
But I'll tell you though, if we really think about it, we were probably not that spontaneous when we were younger. When we would go out on a date, right? We would plan out what we're going to wear, where we're going to eat, what we're going to look like, what we're going to do, what that night is going to look like, right? So everything was planned, even though it seemed like it really wasn't planned, right? So
the planning is not new.
What?
I said, so the planning is not new, or as new as we're thinking or imagining it is.
Yeah, so it's just reimagining things and remembering that we did actually plan things, and that now, even if we have to schedule in, say, like a date night or schedule in that 15 minutes with our partner, it's okay to plan, and it doesn't ruin that spontaneity, right? We still have to be mindful and be intentional about it, and to create that time with our partner. And even if it looks a little bit different, when we invest that time in our relationship, it's going to give us a lot back, a lot more in return. Right? Yes. And then, of course, writing down what you want and communication, like we talked about before. Communication is so important in a relationship. It really is the foundation of every relationship. And so when you're able to communicate what you want, what your likes, and what your desires are, that only increases that emotional connection between you and your partner, which then, leads to a more satisfying physical connection.
Excellent. Thank you so much, Dr. Sadaf. I'm also learning, as I'm sure people who are listening are learning as well. So prioritizing communication, staying flexible, being open-minded to accept change as stages of life change as well. So allowing ourselves to change with it. Wonderful, wonderful, wonderful tips for all of us as we're listening to this and thinking about this. I want to thank you so much for joining me in this conversation today. I wanted to highlight to anyone, in case anyone's joined late, that today we talked about sexual health as part of mental health, as an important part of mental health, by the way, and we focused on hypoactive sexual desire disorder and what it means, decrease libido, and ways to look at it, and how to some tips to help us address this if we are experiencing this in our lives. I also want to highlight that good sexual desires, good sexual engagement as in and out of a relationship generates serotonin, generates a lot of our feel-good hormones, and a very important part of our well-being, our mental well-being. Also, for people in relationships, we know that healthy relationships allow us to feel well and feel good. So if this part of our relationship is mended and doing well, then we have a higher chance of feeling well overall. Dr. Lodhi, thank you so very much for sharing with us. If people are wanting to talk to you, get some coaching, some education, how can they find you?
Yeah, so I have a website called drsadaf.com. They can also email me at drsadaf@drsadaf.com. I am on Instagram and TikTok, and my handle on there is at Dr. Sadaf OBGYN. I'm also on YouTube at Dr. Sadaf Intimacy Coach. And I also have a podcast called the Muslim Sex Podcast, where I talk about relationships and intimacy, and we talk about a whole bunch of things. So it's really good information on there. And so if people are wanting to listen and to binge, there's a whole bunch of podcast episodes on there.
Wonderful, wonderful. We thought that was really special when I first kind of connected with you. The fact that you're also focusing sometimes on populations that maybe have been raised in religious. I was raised very religious, Christian, but religious as well. And, Islam, or maybe people who were raised in conservative religious cultures and things like that, helping them to be comfortable with sexual intimacy, desire, and things of that nature. I thought that was really special and a very well needed service in our communities. Thank you so much. I'm going to pin that in our post. Any final words, thoughts that you wanted to leave before we wrap up for today, Dr.
I just want women to know that, I help women with sexual confidence so that they can find more pleasure in their relationships. And there's nothing wrong with that. There's nothing wrong with wanting it. And if it's bothering you, you should definitely seek help, because there's lots of providers out there that are willing and able to talk.
Wonderful. Thank you. That'll be all for today. For everyone listening, again, I'm Dr. Bolanle Akinronbi at Bright Minds MD, a private psychiatry practice in New Jersey, where we help people with depression and anxiety disorders and other forms of mental health challenges feel better and live better. That'll be all. Thank you so very much.
Thank you so much.
Thank you, Dr. Lodhi, for your
Thank
time
you
as well. Thank you. Thank you for listening. Don't forget to share this with a friend or two. Until next time, it's Dr. Bolanle on the Bright Minds MD and Your Mental Health podcast. Ciao.